Hello, my name is Amara, and today we're going to be talking about ADHD and anxiety comorbidity. When we talk about comorbidity, we're talking about when two disorders are diagnosed together. So, in this case, we're talking about when one patient is diagnosed with both ADHD and anxiety. So what are ADHD and anxiety? ADHD stands for Attention Deficit Hyperactivity Disorder. This is a disorder that is seen in both childhood and adults, which to some may be surprising, since typically it's seen in childhood more commonly. But ADHD symptoms are seen to continue into adulthood. These symptoms include restlessness, inattentiveness, it can include irritability, and many other symptoms. As far as anxiety goes, anxiety can be seen in multiple disorders, including post-traumatic stress disorder, acute anxiety disorder, or obsessive-compulsive disorder. However, in this situation, we're talking about generalized anxiety disorder. Generalized anxiety disorder is also something that can be seen in both adulthood and childhood that can affect their lifestyles and their overall life satisfaction. ADHD and anxiety are common comorbidities, which means they're commonly seen and identified together. So, what makes them comorbid? What symptoms cross over between the two disorders? And what are the effects? Why do we care? As mentioned in the slides before, one symptom that's comorbid or common among both disorders is that of restlessness. Inattentiveness is also another symptom common, as well as mind wandering. All of these symptoms have their own specific roots. However, they can make it difficult for a patient to function in a classroom setting, a workplace setting, or even in their own personal relationships. This is because they may struggle with emotional regulation or executive functions. In a classroom, a child might struggle to listen to the teacher or focus on the board because they hear the tapping of a pencil behind them. An adult might struggle taking orders in a workplace or seeing the reason why they need to do what it is their boss told them. So how are these treated? Why is it important that we treat them? Well, as mentioned before, the implications can cause issues in people's personal lives, in their work lives, and in their school lives. Often ADHD is treated using amphetamines or methylphenidate, which are both stimulants. On their own, these treatments can be seen helping patients immensely. Some also treat ADHD using cognitive behavioral therapy, or CBT, which also shows immense benefits through that therapy. However, these treatments are best used when they're utilized together. The same can go for anxiety disorders. Anxiety is typically treated using SSRIs, or selective serotonin reuptake inhibitors, or cognitive behavioral therapy. On their own, each of these treatments are immensely effective. However, they're most effective when used together. This can help both children and adults to succeed in their everyday lives and reduce frustration and tendency to give up. So, as mentioned, ADHD and anxiety are often best treated using both medication and therapy. This is seen as well when we look at ADHD and anxiety being treated together, because each case is unique, each patient is unique. Symptoms are unique amongst the patients, which is why it's super important for caregivers to understand the symptoms of their patient. Not to just look at the diagnosis criteria and say you have ADHD or you have anxiety and leave the patient be, but to understand which symptoms are more prevalent in that patient and understand the root of them. It's also important to understand the treatments and what treatment is best for which symptoms. It can often be seen that a caregiver might say, this child needs to be on Adderall. This is common in the school systems and can be seen to help the patient do better in school, do better on tests, to be able to focus on what their teacher says. However, for some patients, treatments such as methylphenidate can cause issues in those with comorbid anxiety. It can increase their anxiety, which is why it's important for caregivers to understand the implications of their treatments and to understand their patient individually rather than just as a diagnosis. So this is a call to action. This is inviting caregivers to educate themselves. In conclusion, as we look at what we've went over, we've gone over the symptoms, the age ranges of which people are diagnosed with these disorders, and why it's important. This is important for caregivers and parents, friends, family to all understand so that they can know how to best help those who suffer with ADHD and/or anxiety. Each person's situation is individual to them. It's important that we know how we can best help them. This is also a call for research to be done, looking at the individual symptoms of anxiety and ADHD and how they interact with each other. Because someone may have more inattentive symptoms, some may struggle with sleep, they may struggle with restlessness in social situations. If we're able to understand which symptoms are more prevalent and the root of these symptoms, why it is that this patient struggles with this more than others, then we can target that treatment. We can individualize their cognitive behavioral therapy. We can know which medications to avoid. It's also important that we understand ADHD implications as well as anxiety implications among adults and children. Often there's a stereotype that ADHD is only common in children, but that's not true. It affects many adults every day in their everyday lives, and they're just told to toughen up and keep moving. But these issues, these disorders do cause issues in their workplace, in their lives, and we can increase life satisfaction if we're able to identify these symptoms and give them specific treatments. So overall, my invitation is to educate yourself on these disorders, to invite your friends to educate themselves, and if you're a researcher, to do your research, to find ways that you can look at the symptoms, look at these disorders, and how you can best help patients to have better life satisfaction. Thank you.